My name is Emilie Duchesneau. I'm an assistant professor at Wake Forest University School of Medicine, and I received a PhRMA Foundation Faculty Starter Grant in Value Assessment and Health Outcomes Research. So I was always really interested in health and healthcare as a child, but I knew I didn't want to be a medical doctor. And in school, I really loved math and statistics. So then when I went to undergrad, I became acquainted with health economic research and other types of research. And this really married my interest in understanding health and healthcare in populations, but also my love of statistics. And so ultimately, I decided to pursue a career as an epidemiologist to understand different patterns in the population and really understand these different diseases. In my PhRMA Foundation Faculty Starter Grant, I'm going to be evaluating the suitability of using Medicare Advantage data for health services research in aging populations. Older adults over the age of 65 in the United States have the option to enroll in Medicare plans for health insurance, and they can either enroll in traditional fee-for-service plans, which are administered federally by the Centers for Medicare and Medicaid Services, or they can enroll in Medicare Advantage plans, which are administered by private health insurers. Historically, for research purposes, we've only had access to Medicare fee-for-service data to understand health services and health outcomes in the aging population. But recently in 2019, CMS began releasing Medicare Advantage data for aging research. But a lot of questions remain about the suitability of using these data for aging research. So in my project, we are going to be evaluating the suitability of using Medicare Advantage data to measure things like comorbidity burden, frailty, dementia, and other important aging-related outcomes. And this is really going to further the field of aging research because we have the potential to really improve the sample sizes, generalizability, and diversity of our studies that leverage Medicare data to answer important health research questions. Ultimately, I think this is going to have the greatest impact on the older adult population who are the recipients of healthcare services, because we'll be able to use Medicare data to answer really important questions that may have policy or clinical decision-making implications. This PhRMA Foundation Faculty Starter Grant is a huge milestone and honor for me. First and foremost, it's going to give me protected time and financial support to generate results from this study that I'm really excited about and think has really important clinical and research implications. It's helping me hire staff members, helping me build my research team. It's really exciting and getting things moving. And finally, one of the most exciting parts is also being connected to other researchers across different institutions who are studying similar or different things, but having the opportunities to meet with others and learn. So the best piece of advice that I've gotten from other people that I really try to use daily is to develop really good writing skills and writing habits early. So for me, this looks like writing different things at least 30 minutes every day, whether it is a grant application or an application for an award like the PhRMA Foundation Award, or working on a manuscript that I have currently in progress. And this little habit has helped me stay productive, move things forward. And I always try to put words down on paper, even if I think in the first initial draft they're not very good, because there's always opportunity to edit them. And as long as I have somewhere to start, it makes the process a lot easier. My long-term goal is to lead an independent, collaborative, and multidisciplinary research agenda that's really focused on promoting healthy aging in older adults and maintenance of independence. I really want to work with other scientists within my institution as well as externally, and then, of course, mentor and work with the next generation of scientists, including students, postdocs, and staff members in my lab, on exciting projects related to aging and epidemiology.